Good morning. It is 8:31 here in Chicago, so I think it is about time to get rolling on our webinar this morning. My name is Jeff Drope. I'm a research professor here on the Tobacconomics team at the University of Illinois at Chicago. It's my great pleasure to be here today with a really fantastic panel of experts. I welcome you from our Tobacconomics team and from our colleagues at the Pan American Health Organization based in Washington, D.C. It is, of course, a really important topic today in terms of tobacco taxation as an opportunity for public health. Ostensibly, it's about the results from a very recent publication that we have developed called the Tobacconomics Cigarette Tax Scorecard. And Dr. Frank Chaloupka will be here today to discuss some of the results broadly and also specific to the Caribbean sub-region. But it really also is an opportunity for us to talk about tobacco taxation as I said, a tool and an opportunity for public health in the sub-region. And so I think the conversation will range widely today. I'd like to do a quick bit of housekeeping. We have a Q&A box, and so please, by all means, we're very welcome your comments and questions. So please use the Q&A box for that. We will have time, hopefully, to answer most of those questions in the panel session toward the end of the webinar. And those that we don't, we will actually try to answer each question as well individually. If you could also identify yourself with your questions, that's really helpful to us because it helps us to tailor our responses to you. Let me take a few minutes to introduce today's panelists. As I said, we have a really all-star panel here today. To start, we will begin with Dr. Frank Chaloupka. Many of you on the webinar will know Dr. Chaluka. He is a research professor at the University of Illinois at Chicago, where he is the director of the Health Policy Center within the Institute for Health Research and Policy. He directs the Tobacconomics program, and I'm sure many of you already know that his many decades of research has focused on the effects of national, state, local policies and other types of influences on youth, young adult and adult health behaviors, which of course would include tobacco use, but also other activities such as physical activity, illicit drug use, diet, alcohol use, etc. He also researches the broader impact of these policies, including their effects on the macroeconomy, illicit trade, and health and economic inequities. Also have Maxime Roche on the panel today. He is a health economist who's been working with the Economics of Non-Communicable Disease team at PAHO since 2019. His work focuses on economic analyses of the return on investment of interventions to prevent and treat NCDs and mental health conditions, as well as monitoring, fostering, and developing evidence on the use of fiscal policies for health in Latin America and the Caribbean, which would of course include excise taxes on tobacco, among other unhealthy products. Prior to joining PAHO, Mr. Roche was a consultant for the World Bank and participated in the development of the Global Health Equity and Financial Protections Indicators database that I'm sure many of you know. Our next panelist is Dr. Abdul Abdulkadri, who is coordinator of the Statistics and Social Development Unit at the United Nations Economic Commission for Latin America and the Caribbean. He is based in the Subregional Headquarters in Port of Spain, Trinidad and Tobago. He is serving as ECLAC's focal point for the 2030 Agenda for Sustainable Development in the Caribbean. Since joining ECLAC in 2015, he has been leading research on many important subjects of sustainable development, and obviously with a very large emphasis on non-communicable disease. Prior to his work at ECLAC, Dr. Abdulkadri was a professor of applied economics at the University of the West Indies and also served as the first associate dean for research and innovation. And then last, and certainly not least on our panel today, we have Rosa Sandoval from the Pan American Health Organization. She is advisor on tobacco control, where she is responsible for providing technical cooperation for the implementation of the WHO Framework Convention on Tobacco Control for the region of the Americas. She also leads the Economics of Non-Communicable Disease team with the objective to facilitate the generation and use of sound evidence to support policy coherence in all of these areas. Prior to joining PAHO, Ms. Sandoval worked in several ministries in her home country of Peru, mainly focused on critical aspects of social development. So it really is an all-star cast today, and I'm going to actually hand it now over to Dr. Chaloupka to discuss the report card.
Great, thanks, Jeff, and thanks to everyone for joining. I appreciate the opportunity to talk with you today about the work that we've been doing on the Tobacconomics team in producing the Cigarette Tax Scorecard. So what we are doing here is really trying to better understand how governments can most effectively use cigarette taxes to maximize their health and revenue impacts. And this is something that we've spent the last about year and a half or so working on developing, and will continue to develop as we go forward. So next slide, please. So in the Cigarette Tax Scorecard, we really decided to take a broader look at how governments are taxing cigarettes and how effective this taxation is in terms of its impacts on public health and impacts on revenues. In the past, we've really, in general, I think, focused on particular aspects, one or two aspects of cigarette taxes. But here what we're trying to do is to look more comprehensively, look at what we think are the key dimensions of cigarette tax systems in terms of their impacts, again, on health and on revenues. So a few things that we focus on here, based on the evidence that's been developed over the last several decades, are cigarette prices, changes in cigarette affordability over time, the share of cigarette taxes in retail cigarette prices, and then the structure of cigarette taxes. So we have, at this point, hundreds and hundreds of studies from every part of the world showing that higher taxes, higher prices are very effective in reducing cigarette smoking, reducing the number of people who smoke, reducing how much they smoke, and particularly effective in reducing smoking uptake among young people, and in reducing some of the inequalities, the disparities that we see in tobacco use across different populations, given that lower income populations respond more to those prices. But we've also learned that it's not just enough to have high prices, it's also important for prices to be increasing over time and increasing faster than inflation, faster than income growth, in a way that's going to reduce the affordability of cigarettes. And that's really what's going to drive consumption down, drive smoking down. If we see prices not rising fast enough, if we see income growth outpacing the increases in prices, cigarettes are going to become more affordable over time, and we won't see the sort of reductions in smoking that we would like to see achieved by the increases in taxes. One of the metrics that's been widely used over the last 20 years or so is looking at the share of taxes in retail cigarette prices. We started out over 20 years ago with the World Bank recommending that cigarette taxes account for between 2/3 and 4/5 of retail prices. The WHO has recommended that excise taxes in particular account for 75% of the price of cigarettes. And in the Empower reports that the WHO puts out, every 2 years, they use a metric of cigarette taxes accounting for 75% of retail price as a metric for high achieving countries. So we recognize that these high shares of taxes in prices are generally going to be associated, but not always, with high prices. And they'll also be important in reflecting the revenues that governments can be generating from high taxes, high prices. And then the last thing that we emphasize in the scorecard is cigarette tax structure, how governments are taxing cigarettes. There are different types of taxes that can be applied. We really focus here on excise taxes. And what we've learned as a result of some of the research that we and others have done is that simple, uniform tax structures are going to be particularly important. They're going to be easier to administer. They're going to lead to relatively smaller differences in prices, so that as taxes and prices are going up, it reduces opportunities for smokers to be switching down to cheaper brands. And again, we've also recognized within this that how those taxes are applied is going to be important. For governments that use specific taxes, for example, taxes per pack of cigarette or per stick, We recognize that those taxes have to be increased in a regular way to not allow the affordability of cigarettes to increase. So that's going to be particularly important in how we score countries in the scorecard. We've also recognized that things like the retail price is a key base for ad valorem taxes, taxes that are levied based on some measure of value or based on price, as a way of minimizing opportunities for tax avoidance. So again, we really try to capture these different dimensions in the scores that we use in our scorecard. We construct individual scores for each of these 4 different components, each ranging from 0 to 5, and then we take the average of those 4 components to come up with an overall score. Again, that ranges potentially from 0 for countries that are doing very poorly all the way up to 5 for countries that are hitting the highest marks on each of the different components. Next slide, please. In doing this, we've used the data that come from WHO's Empower reports, the biannual reports on the global tobacco epidemic. These come out every 2 years in odd years with data from the previous year. So in the scorecard, we've used the data from the 2019 report, which reflects cigarette taxes and prices in 2018. And then we've also used the historical information to develop comparable measures for 2016 and 2014. This is something that we're going to continue to do as the Empower reports come out. Every 2 years, we'll be updating these scores, looking at what's been happening in terms of progress or lack thereof with cigarette taxes globally. So later this year, we'll be releasing the next iteration of the scorecard, which will have the data for 2020. This is something that's gone through fairly extensive peer review. We solicited inputs from economists, from people in various organizations globally, the World Bank, WHO, elsewhere. PAHO, Rosa and Maxime in particular have been very helpful in contributing to the development of the scorecard. So it's something that we think has been well vetted, and that is, again, very consistent with the sort of recommendations and the research evidence that we have on tobacco taxation. And this really does then follow from the guidelines, the recommendations that are made in different sources. We really focus on, for example, the guidelines for implementation of Article 6 of the Framework Convention, the one that focuses on tobacco taxation, talking about the importance of simple, specific tax structures or mixed systems that give more emphasis to the specific tax component, talking about the importance of raising taxes in a way that reduces affordability, and those sorts of things. We rely heavily on the WHO's technical manual on tobacco tax administration that contains a lot of these recommendations, similar recommendations coming out from the World Bank as well. And again, really rely heavily on the research evidence that's developed over the last several decades, looking at how effective tax can be in reducing tobacco use and generating revenues. So the next slide, please. So again, we've gone through this process, developed these overall scores based on the individual components. Scores can range from 0 to 5, from the lowest to the highest. And if we look at the next slide, we can see that there is considerable variation around the world in terms of countries' scores on the scorecard. So the darker countries are in this map, the higher their scoring, the lighter they are. The lower the scores, and the countries that are in tan there or gray are the countries that we don't have data for in 2018. So again, considerable variation across countries in terms of the scores that they're getting. Some countries doing relatively well, other countries not doing as well. If we look at the next slide, we can see that this, what we see on the map is pretty consistent with what we're seeing here. And there's a few basic takeaways from this. I think the first one is that countries have a lot of room for improvements in their cigarette tax systems. So again, this is a 5-point scale. If we look at the global average, it comes in just over 2 points on that 5-point scale. So considerable room for countries to improve their cigarette tax systems. If we look regionally, we can see that, again, there's no region that's doing particularly well. The European region is the only one that comes out even above half of what the potential score is, with a score of 2.79 overall. We can see that the African region, the Eastern Mediterranean region doing relatively poorly. The Euro region is doing better than other regions, I think in large part because of the European Union's tobacco tax directive, which does set some pretty strong standards for minimum taxes, for the share of tax and price, and those sorts of factors that do lead to relatively high taxes, relatively high prices, and for the most part, good tax structures across the region. But again, there's no region in the world that's doing really well when it comes to the scoring on this. We can also see that there's a really clear gradient with income. So we can see that low-income countries are doing particularly poorly, and we see that the scores again go up as income rises. But again, even high-income countries where the average score is 2.85 have a lot of room for improvements, a lot of room to move up closer to that maximum of 5 points on the scale. In the next slide, we can see, if we look at the Caribbean subregion in particular, that the region is not doing very well when it comes to its tobacco tax systems. The scores on average for the subregion are 1.82. So again, below what we see globally, below what we see in most of the regions in the world, and below what we see in the rest of the Americas. North America, again, comes in relatively high, 2.88. Latin America, 2.26, with the Caribbean at 1.82. Which contributes to that relatively low score that we saw overall for the Americas region of 2.13. So again, a lot of room for improvements among the countries in the subregion in terms of their tobacco tax systems. Next slide, please. If we do look globally, we can see there are some countries that are doing relatively well. So the two countries that score the best on our scorecard are Australia and New Zealand. They come in at 4.625 on the scoring. And this is because of a few basic things. They have very good tax structures, uniform specific taxes that are regularly adjusted for inflation in New Zealand, for income growth in Australia. They've been raising their taxes every year beyond that in a way that reduces the affordability of cigarettes and has made their cigarette prices among the highest in the world. And as a result, they have relatively high tax shares. So again, you can see that there are certain components that really are effective in driving up scores. And we see this in countries that are doing very well. In the next slide, we see, though, that in the region, we don't see the same sort of systems in place. So there are some countries that are doing relatively well. Suriname, Trinidad and Tobago, Jamaica, all scoring over 3 on the scorecard. So definitely the leaders in the region. Bahamas also would come in very high. We didn't have data for them in 2018, but as you'll see in a second, they scored well in the years that we did have data there. So there are some countries in the region that have a lot of the characteristics that we're looking for in terms of good cigarette tax systems and that do score well on the scorecard. But for the most part, you can see most of the countries in the region come in at 1.5 or lower on our scorecard, which is going to reflect the fact that their tax systems are not anywhere close to as effective as they could be in terms of their public health impacts, in terms of the revenues that they could generate. And Antigua and Barbuda are the lowest in the region, again, just barely over the 0. They get a 0.5. So the next slide. If we look at the different components that are driving this, you can see that countries do a little bit better in the region when it comes to their tax structures. We do see countries, for the most part, having relatively good tax structures, but they really are not doing particularly well, especially when it comes to things like the changes in affordability. Most of the countries in the region have not seen significant reductions in the affordability of cigarettes over time that have resulted from increases in taxes. So there are some countries that have done well in that respect, but for the most part, affordability is not declining significantly throughout the Caribbean subregion. And that's going to pull these scores down. The low prices in many of the countries are going to be pulling the scores down as well. So again, significant room for improvements. So the next slide. We can see that there has been some progress over time in some countries, but again, if we look across the region, that progress is uneven. Some countries getting better, some countries getting worse, a lot of countries really not changing much over time. And again, you can see, as I mentioned earlier, Bahamas would actually be doing relatively well, was leading the region in 2014 and 2016, but we don't have data for 2018. But I suspect that that's still going to be the case there. So next slide. Just to wrap this up, the conclusions, we'll go to the next slide. What we see again is like we see around the rest of the world, there is considerable room for improvement, a lot of untapped potential for cigarette taxation in the Caribbean subregion. The best countries, only a handful of countries scoring above 3 on our scale, but still have room to improve their tax systems, with most of the rest of the countries scoring 2.1 or lower, and indeed most of them scoring below 1.5 on our scale. Most countries have low tax shares, and as I was talking about, cigarettes are not becoming less affordable, a key driver of demand, and as a result, that's going to be pulling down the scores. So countries are doing mostly well when it comes to their tax structures, uniform specific taxes in many, but again, some room for improvement with introducing automatic adjustments to those specific taxes to make sure that they're keeping pace with inflation and income growth in countries in a way that would at least not allow affordability of cigarettes to be increasing. So again, I think that hopefully this will be a useful tool to people in the region, and highlight some of the things that are being done well, some of the countries that are really effectively using their tax systems to reduce tobacco use and increase revenues, and also to identify places where countries have room for significant improvements in doing this going forward. So we'll have a chance to talk more about this in the Q&A section, and now I will turn it back to Jeff. Thank you.
Thanks, Frank. That was fantastic. Really a whole lot of information packed in there. So thank you very much. I'm now going to hand the reins over to Maxime Roche, who is going to get into a little bit deeper dive into the tobacco tax situation in the Caribbean subregion. Thanks, Maxime.
Thank you very much, Jeff, and thank you, Frank, for your presentation. At PAHO, we're very excited about the Cigarette Tax Scorecard. It's a very important tool, and it will provide policymakers with an actionable assessment of their country's cigarette tax policy. So thank you for joining us today. So yes, today I'm going to talk about tobacco taxes in the Caribbean. So next slide, please. So let's first get a sense of this epidemic. It's a devastating epidemic, killing more than 8,000 people a year, 8 million people a year, representing more than 14% of total death, and 80% of smokers live in low and middle income countries. Out of those 8 million, 1 million people also die from secondhand smoke. And in addition to that high health burden, the economic burden is also very high. So what we see on the right-hand side here is that the global economic losses due to smoking attributable diseases, including not only health expenditures, but also productivity losses, has been estimated in 2012 at $1.4 trillion globally. That represented 1.8% of GDP that year. Next slide, please. So let's look at tobacco use prevalence in the Caribbean in adults. So we have data here from 5 countries from 2018 for adults and 15 years old and older. What we see here is that it ranges between 8 to 13% of adults that currently use tobacco, and that men use it more than women. Can we go to the next slide, please? Here we're going to look at adolescents between 13 and 15 years of age. And we have data here from the whole subregion. And what we see is that it ranges from around 8% in Antigua and Barbuda up to 25%, 1 in 4 adolescents in Dominica. And there is no really good number for that prevalence for adolescents. The only good number is 0. Let's go to the next slide, please. So what can we do about it? So as Frank explained, excise taxes are the available tool, the available instrument for policymakers to increase prices. So how does it work? Excise taxes can raise the relative price compared to other products and services by raising this price, decreasing the affordability of those products, and then hopefully decreasing the consumption based on how consumers will react to this increase in prices and decrease in affordability. So what the international evidence tells us is that significant increase in tobacco product taxes and prices has been demonstrated to be the single most effective and cost-effective intervention for reducing tobacco use. Next slide, please. So now let's go in detail in the Caribbean. So on the left-hand side, this is the graph about the tax share. So the share of indirect taxes in the price of the most sold brand of cigarette here in 2018 in the Caribbean. So what you see here, the different colors in dark blue, you see specific excise taxes. So a fixed amount either per stick or per 1,000 sticks of cigarettes or per kilogram of tobacco. In light blue, you see the type of taxes that are ad valorem, a percentage of the value of the value of the pack of cigarettes. You see then in gray value-added taxes or sales taxes, and in green, light and dark, you see other type of taxes that include import and also custom duties. So what we see in the region here is that in all countries, we are far from reaching the recommended threshold by WHO and by other organizations, as Frank mentioned. So the recommendation is to reach 70% for the excise tax share, meaning the share of total excise, specific and ad valorem, in the retail price. And what we see here, it's the light blue vertical line that you see in the slide, and no countries are reaching this threshold. And in addition, we have a second threshold that we recommend in WHO, which is to reach 75% in terms of total tax share, the sum of all the colors, all the taxes that you see here in the graph, to reach 75%. And once again, here in the sub-region of the Caribbean, no countries are reaching that threshold. In addition, the median total tax share in the Americas as a whole, including Latin America, is 47%. And what we see here is that Suriname is at the median, St. Lucia is above the median, and all of the countries in the sub-region of the Caribbean are below the median tax share of the region. Therefore, tax rates are low in the Caribbean compared to the rest of the region. On the right-hand side, we look at prices and affordability and changes in affordability. So what we see here, we're using the international dollar at purchasing power parity to be able to compare between countries. And what we see that there is a very big disparity in prices in the sub-region. In Dominica, around 2.4 international dollar, and 8 times more in Jamaica here. So we see that the range is very wide. And what we see, and what's really important, is not only to increase the prices, but decrease the affordability of such products. And we see that in only 4 countries since 2008, so since the Global Tobacco Report started in 2008, calculating affordability and tax share and getting data on those topics, we see that since then, since 2008, only 4 countries have reduced the affordability of the most sold brand of cigarette in their country: Jamaica, Trinidad and Tobago, Suriname, and Barbados. A lot of others have had no statistical change. And then 2 countries, Belize and Guyana, have, in addition, the affordability of cigarettes in those countries have increased, which is the country of what we want. And we see also on the last column that in between from 2016, so it's the last year that we have the data before 2018, only here half of the countries had decreased the affordability of cigarettes. So I want to repeat here again that only significant changes in affordability can lead to significant reduction in consumption. Next slide, please. So now we're going to look at the structure of those taxes in the sub-region of the Caribbean. So what we see here is only 1 country doesn't have excise taxes. It's Antigua and Barbuda. The rest of countries have excise taxes, but we lack data in 2018. This table is from the last data that we have, 2018. And we see that the Bahamas and Haiti, we could not collect data that year. But for all the other countries, we see that most countries have a specific excise tax in place compared to only 2 countries with an ad valorem excise, which follows best practices. What we see is that all of the excise taxes in place are uniform, which also follows the best practices, meaning that the tax rate doesn't change according to characteristic of the cigarettes, for example, length or the type of tobacco in the cigarette. Then the third column doesn't apply to the Caribbean because there is no mixed regime in the Caribbean. What we see in the 4th column, which is the specific tax component, being automatically adjusted for inflation. That's what also Frank mentioned, the importance to adjust for inflation or income growth in order not to lose the real value of the excise tax over time. And we see that for the two countries that we had data, St. Vincent, the Grenadines, and Trinidad and Tobago, this was not in place. There was no automatic adjustment for inflation or other economic indicator in place for specific excise taxes in those countries. And finally, for the two countries that have an ad valorem excise structure, we could see that the tax base, the value that's the base on which the rate will apply, was set early in the value chain and not close to the final retail price, therefore reducing the tax base and therefore reducing the impact of the tax on final retail prices. So here, not following best practices. And finally, also not having in place a minimum specific tax that will help having a minimum floor tax to increase the price of the cheapest and more affordable brands. So can you move to the next slide, please? So in a nutshell, as Frank already highlighted in his presentation, the best practices. The best practices would be to reach, in terms of excise taxes, a 70% as a share of 70% of the final retail price. In terms of total indirect taxes, 75% of this final retail price. And as we saw in the Caribbean, most countries were below 50% of except St. Lucia, below the 50% of the final retail price. So increase in excise taxes must be significant enough to increase the real price and reduce the affordability of tobacco products. And in terms of structure, as we saw in the last slide, the best practices that you can find also in the guidelines of Article 6 of the Framework Convention for Tobacco Control, in the WHO Technical Manual on Tobacco Tax Administration, and also on publications of other organizations such as the World Bank, as Frank mentioned. For excise tax structure needs to rely more on amount-specific excise taxes. We saw that in the region, in the sub-region of the Caribbean, most countries rely more on amount-specific excise taxes. It needs to be automatically adjusted for inflation or income growth, not to lose of their real value in time, over time, and then be uniform tax structures. So next slide, please. Higher and structurally improved excise taxes represent a win-win-win-win, as we like to call it, for policymakers and for government. And why is that? Because it could reduce the affordability of tobacco products and then in turn reduce their consumption. And that can have several impacts on society as a whole. So first, on health, of course, it could help improve health outcome by reducing the consumption of such harming products. Then it could also reduce the associated healthcare costs and therefore increase the financial viability of health systems. That's a second win. A third win is that it increases the well-being and the productivity of the workforce, as we saw in the first slide, that it has a big impact on productivity. And then finally, bring additional excise taxes revenue that can be used to finance development. So this is the win-win-win-win for government. Next slide, please. And to emphasize that this win-win-win-win is really important now during COVID, and now is the time to increase tobacco taxes. Tobacco taxes contribute to prevent NCDs and reducing the consumption of tobacco products, which are both linked with higher risk of serious complications for COVID-19. So it leads to healthier population and of course a more sustainable health systems. But in addition, as I just mentioned in the previous slide, it brings additional and immediate source of tax revenue that can be used to finance economic recovery plan for COVID-19 or also to respond to the COVID-19 pandemic today. And in the long run, this additional tax revenue can participate in increasing the budget for public health in general and towards achieving universal health. Next slide, please. So I wanted to thank you for your attention and just mention that you can find more information on the tobacco control topic webpage of PAHO and our newly developed health taxes webpage. And also on that webpage, you can find information on our last webinar that we did on health taxes with Abdul, that's going to talk after me from ECLAC. And you can find also important publication and mandates. And thank you very much for your attention.
Thanks so much, Maxime. That was fantastic. That really was a nice deep dive into many of the issues that Frank raised initially with the scorecards. So that was really a beautiful compliment. Thank you. It's now my pleasure to introduce Dr. Abdul Abdulkadri from ECLAC. As we've mentioned, it's a great pleasure to have a development expert like Dr. Abdulkadri here to discuss this issue from his perspective. So Dr. Abdulkadri, thank you.
Thank you very much, Jeff, for the introduction. And I really enjoy listening to Frank and Maxime. I think they've done the heavy lifting. I mean, the presentations are very informative. From my end, it's just to add a little bit of perspective with respect to the developmental impact of NCD, which we know tobacco smoking to be a major risk factor of these non-communicable diseases. Specifically, I didn't quite catch that. Specifically in the Caribbean, the rate of mortality and premature, the rate of morbidity and premature mortality is quite high compared to other sub-regions. And we know that tobacco smoking is a major risk factor for NCDs. And to put things in perspective, what we have is that in the Caribbean, the proportion of all deaths, the proportion of mortality that NCD is accountable for, attributable deaths due to NCD, will be in the range of 57% for Haiti to a high of 83% for Barbados. So that shows that half of all deaths in the Caribbean is at least due to NCD. So, and with tobacco smoking being one of tobacco consumption or use being a major risk factor for NCDs, then we know that this issue needs to be dealt with all the policy measures that are available. And in terms of development, we all know the 2030 agenda and the Sustainable Development Goals. One of the 17 goals is to ensure that we have good health and well-being for all people of all ages. And in particular, there is one of the targets. There is a target in SDG 3 that focuses on the reduction of mortality, premature mortality due to NCD by 1/3 by the year 2030. So if we are to achieve this goal, then we need to look at all those factors, the one important one being tobacco use. And not only SDG 3, which focuses on health. I mean, we know health is wealth, and when you have good health, that will impact on other areas of life. And when you have, when your health is not adequate, or you have an unhealthy workforce, we know what implication that will have, not only to the impact on healthcare financing, but also on other areas of development. So having good health will have implication for many other SDGs, or promoting good health and well-being, like the SDG 1 on no poverty, SDG 2 on zero hunger, the quality education, the reduction of inequality, the promotion of economic growth and decent work. So as well as the climate action. So all these, one way or the other, have good health and well-being, have implications for these NCDs, for these SDGs, the Sustainable Development Goals. The evidence that we have, and as Frank earlier on stated and Maxime also emphasized, is that the negative impact of consumption, there is extensive evidence broadly, and even in some Caribbean countries, especially in Jamaica, that shows that substantially increasing the price of tobacco product through taxation is the single most effective way of reducing tobacco use. So if we're looking at reducing tobacco use, or even the ultimate goal is to improve health and to reduce premature mortality. So if tobacco use is a risk factor for this, then we need to look at how to, the different policy measures that could be employed to reduce tobacco use. And with cigarette prices or tobacco prices being one issue of addressing or limiting the use or controlling the use of tobacco products through taxation, then we need to look at that. In the Caribbean, adult smoking prevalence is quite high. And again, it ranges between 7.5% to the prevalence, between 7.5%, a low of 7.5% in Barbados, to a high of 11% in Jamaica, and even higher in Guyana, which is 12%. And if we look at the gender disparity in prevalence of smoking, men tend to use tobacco product more than women. So there's a higher prevalence among men compared to women. And among adolescents, the prevalence rate of smoking ranges between 6 and 14%. Excuse me. And it's also higher among boys than girls. For example, in Jamaica, 14.5% of boys happen to use tobacco. So the prevalence among boys also is higher, which is reflective of the general population, where men have a higher prevalence of tobacco use. Secondhand smoking, which is another issue. We tend to focus a lot on those that on smokers and to get them to reduce smoking. But there is also an implication of those who are exposed to secondhand smoking. And it's a challenge in the Caribbean and in many countries. This is particularly an issue where you have, more broadly in the region, in Latin America and the Caribbean, where there are data to suggest that 40% of children and youth are exposed to secondhand smoking at homes and in restaurants and other public places. So this calls for policies beyond the use of excise taxes on tobacco products that will comprehensively address the issue of secondhand smoking in addition to the use of tobacco. Now, in some Caribbean countries, there are some countries already have legislation to address smoking in public places or in workplaces or in public transportation. So there are encouraging signs with regards to that, but there still needs to be more needs to be done in other countries that have not adopted such policies or have such legislation. In some countries, in addition to having legislation that addresses the use of tobacco in public places, they also have restriction on the use of tobacco products in educational facilities and in health facilities. So those we have cases, or we have examples, good examples in the Caribbean and other countries of the sub-region who are actually looking to coming up with legislation to address, or policies to address secondhand smoking. But the critical issue, which Frank alluded to and Maxime also mentioned, is that cigarettes are still inexpensive in the Caribbean. And with the exception of Jamaica, for example. So if affordability is still an issue, in the sense that people, even in cases where you have high cigarette prices, if people are still able to consume or afford cigarettes, then the policy would not have been effective in achieving the objective of reducing smoking. So more importantly, as the scorecard demonstrates, the cigarettes are not getting less expensive. But if the goal is to actually reduce smoking, then we need to look at how we can make excise taxes more effective. What the Tobacconomics Cigarette Tax Scorecard shows is that some progress, while some progress has been made in terms of tax structure, like I mentioned earlier on, the proportion, the tax, even though cigarette prices are high, when you look at the proportion of tax in in the whole, in the retail price, it's still very low. So the tax share or in effect, what is happening is that we're leaving money on the table, because even though you have high prices, the proportion of that price that is due to increase due to indirect taxes is still very low. So there needs to be an adjustment to that to more effectively use tax, in particular excise taxes on tobacco products, to achieve the aim of addressing the use of tobacco, to make it less affordable. In addition to using this to address the use of tobacco, there is also an advantage in terms of tax revenue or revenue generation for government. So this tax revenue could be allocated, which the government will get through increase in prices by raising the excise tax on tobacco, on cigarettes. This could be allocated or be earmarked for development purposes to address, for example, health concerns, or to improve the healthcare in the Caribbean. Like, I mean, most people already know that in the Caribbean, public health system is by far the most popular source of healthcare provision, and they tend to be publicly supported. So one way of improving the healthcare system is using tobacco revenue from cigarette taxes to actually improve healthcare provision. There is also the issue of many countries are now dealing with COVID-19 impact, and they are developing responses. There are different measures, and most of these measures have to do they have to do with social support, where you have people who have lost their jobs needing income support, or people who are at the risk of losing their homes or their accommodation being given moratorium to pay. So here is an area where there can be a special provision made for increases in tobacco taxes, which could be dedicated to COVID-19 response measure. And how this is done could vary from country to country based on the specific social support that is required. But more broadly, it will serve as a way to provide support for fiscal deficit that many Caribbean countries will face coming from the COVID-19 pandemic. An area in particular could be with respect to addressing access to education, which has suffered greatly because of school closures and the inequality that is likely to result from access to education through online facilities when majority of the students may not have broadband access. So having earmark for tobacco taxes, increasing tobacco taxes dedicated to providing broadband services to those who may be disadvantaged in the education sector could be one way out. So in general, tobacco taxation is going to be more effective when it's applied along with other tobacco policies. And I mentioned earlier on having legislation to address the secondhand smoking in public places, advertisements and promotional sponsorship being provided by tobacco companies, how that could be regulated, and having graphic health warnings on cigarette packs and other interventions to promote smoking cessation. Just to conclude, there is still a lot that could be done by proponents of tobacco taxation and more broadly tobacco control. And in the region, in Latin America and the Caribbean more broadly, and in the Caribbean more specifically, to reduce smoking prevalence and consumption of tobacco. And like I mentioned, and as as Frank and Maxime have also indicated in their presentation, the tobacco taxation provide a way to a very effective way to lead to this, to achieve this objective. And with the additional revenue that will be generated, there will be a significant opportunity for social and economic, to address the social and economic burden that tobacco use presents. So I would like to end there, and I look forward to the discussions that will follow. Thank you, Jeff.
Thanks, Abdul. That was fantastic. I really appreciate you tying together some of the more technical discussions that Frank and Maxime introduced to the development challenges that we're facing in the subregion. So this was really, really very, very helpful. I would like to invite all of the panelists to turn on their cameras, and I think we can probably turn off the screen, the sharing. Thank you very much, Margaret. I'm going to open this up first to my longtime colleague, Rosa Sandoval, and I'm going to actually pose a direct question to you because I've been on a lot of webinars like this in recent months, and we're a bunch of economists or economically oriented folks that we sit around all day thinking about this, and this is a giant no-brainer in all of our minds, right? And we're like, this is low-hanging fruit, isn't it? And yet, we look at the scorecard and we look at the progress that has been made or not made in so many countries, and we think, why aren't governments embracing this more? And you've been dealing with this for almost 2 decades, and I'd love to hear your perspective of why aren't people embracing this as much as we think logically they should be, and what can we do to get them to do that?
Yeah, thank you, Jeff. Well, I wish I had a comprehensive answer to your question. Then we wouldn't need to be sitting here. Maybe we would just, resting at home, celebrating all the achievements. But no, I think jokes aside. First of all, let me start by saying that I do hope, and I'm optimistic, of course. I think you need to be an optimistic to work in these topics, and I do think that this tool could help us energize the discussion on tobacco taxes in the Caribbean specifically. And I'm going to tell you why I think this tool can help us, and why I think despite the long time that we've been discussing about this, and that we still do not see the results we would like to see, that people do not grab that low-hanging fruit, as you very well said. I do think there is at least 2 aspects that I find that will be conducive to using more tobacco taxes in the subregion, in the Caribbean. The first one is that I do see a movement towards placing tobacco control as part of a bigger public health agenda, and more and having more of an understanding of what Abdul was very well saying, the role that reducing tobacco use has in preventing the onset of non-communicable diseases, which is a huge percentage of the burden in the Caribbean. I do see that, and I say that I do see that because we have 3 countries in the Caribbean, Suriname, and I see Johanna. Johanna is joining us from Suriname today. We have Guyana, and we have Antigua and Barbuda, countries that have recently put in place comprehensive tobacco control laws, as Abdul was mentioning. So, and they have put in place comprehensive tobacco control laws that have been pioneered, even if I include Latin American countries, which were the first one to start introducing these interventions. But the Caribbean took longer, but when they took action, they took a very well action, a very comprehensive action. And they put in place at once 3 of the best buys of WHO on tobacco control: smoke-free environments, banning advertising, promotion, sponsorship, and introducing graphic large health warnings. So what is the 4th best buy that was approved by all WHO member states in 2013 to prevent non-communicable diseases? Tobacco taxes, raising tobacco taxes. And where is it that the Caribbean has not moved forward in the last few years on tobacco taxes? So I would say the time is now. Right? The time is now to do it. You are moving forward on the other 3 best buys. It's time that you move forward on the 4th one. We are all waiting for that, and we're all ready to help on that. So that's one, and I do think, again, the tool can help us because it's very powerful, the messages that this scorecard is giving us, as all of you have said before, and there's lots of room, right, to move forward on this. The second comment that I want to make, Jeff, if you allow me, is about how to move the appetite on tobacco taxes that I've seen in some countries. And Fabian Lewis from the Ministry of Finance of Jamaica is today with us, for example. So there is appetite on the part of some ministries of finance in the Caribbean country. We have Jamaica, we have Suriname as well. I'm not sure if Julio is joining us today. But there are countries in the region that have approached PAHO, that have approached other institutions working on tobacco taxes, interested in identifying how to move forward. And they have moved forward in some sense, in the case of Jamaica, for example. But yet, we are not using enough this tool, which are taxation, as to change the patterns of affordability. It's really bothering, right? That the conclusion is it's not changing much. Right, and that it's not being used. And so here my question, Jeff asked me a question, and in answering I'm providing another question. But so my question to all of us as a community is, how do we place tobacco taxes, and if I may, health taxes, in the COVID-19 discussion? Like Abdul was mentioning it, in the recovering plan discussion. And I would dare to say that I've seen more of this discussion about health taxes, tobacco taxes, and COVID-19 in Latin America. And maybe I didn't, of course, it can be very well that it didn't reach us in PAHO, this conversation, but we have not heard of this conversation in the Caribbean yet. And I think this is something that we need to reflect on and see how to address it. There are countries like Paraguay, like Mexico, that and I'm missing one now here, that have indeed discussed the possibility of funding part of the recovery plans with health taxes. And as one of my colleagues our colleagues at the World Bank said, if we look at the tobacco tax revenue, might be small percentage of the total tax revenue in a country, but if we look at combining, right, tobacco tax revenue with the sugary drinks tax revenue and alcoholic beverage revenue, that is not trivial. So, and we have a very, very clear entry point on tobacco taxes. So I would stop there, and I will just say that not doing something is not an option. There's a huge cost of inaction, and we all should be really paying attention to that. Thank you, Jeff.
Thanks, Rosa. That's really insightful, and I appreciate that perspective. So we're making some progress. So I think that's a really good sign, but much work to do. Do any of the panelists have anything they would like to add to what Rosa has just said?
I'll just jump in and say I completely agree with Rosa. I mean, the opportunity is now with the pandemic and the fact that we know that this is going to hit people with non-communicable diseases harder. So here we have a tool that's going to directly address those non-communicable diseases, health taxes, and at the same time generate the revenues that the governments need to support stronger public health efforts, to support economic recovery. So, I mean, it seems like this is really the opportune time to take advantage of this. So I think the evidence that we have is overwhelming. Now we just need to take that evidence and put it to work and make things happen.
Thanks, Frank. I wanted to raise an issue that was raised in the Q&A section here. Joanna from St. Lucia, it was a really actually great question about the role of duty-free. It's interesting, coincidentally, I've been working on this with my colleagues at the Convention Secretariat of the Framework Convention. It's a really big issue, as you've correctly noted, and probably a very big issue in your sub-region for a variety of reasons. There's no perfect answer to your question. The protocol to eliminate illicit trade in tobacco products does address this. There is an article to address this. And in an ideal scenario, you don't have duty-free. That's probably not realistic. And so a more realistic scenario actually introduces specific safeguards to make sure, if you will, that there's not so much leakage from the duty-free into the regular marketplace. Obviously, there's leakage in a lot of places where, duty-free exists more for tourists and travelers and such, but then it ends up leaking into the regular consumer marketplace. But It is definitely something on the radar of those working on the protocol, and I don't think and Rosa, Maxime, you'll know better than I who are parties to the protocol in the region, but I think it's a very worthwhile protocol. It has many great provisions that countries can implement in order to tackle problems exactly like this one. I don't know if others want to add to that.
Or just to add that in the global tobacco control report, the biennial report that we use for the data for the cigarette tax scorecard, there is also data collected on the ban of sales from duty-free shops. So I can put it in the chat. There is like data for each country if it is banned or not. And I was just putting up the data right now to check it. And no, in the Caribbean, no countries are banning the sales of duty free. So that's really an important topic, definitely.
Yeah.
And also no country in the Caribbean have ratified the protocol to eliminate illicit trade of tobacco products. So that's also another pending thing there in the Caribbean. Most countries in the Caribbean have ratified the Framework Convention on Tobacco Control, but are yet to ratify the protocol to eliminate illicit trade of tobacco products.
Thanks, Rosa. That's really helpful. I see that we're actually out of time. I just wanted to, there was one more question here in the panel box here that I wanted to address because it's a really important one. And this came from Jane from Sabah in the Dutch Caribbean. And she was really asking about what happens when the counter arguments to tobacco control are about tobacco control hurting people in lower socioeconomic groups. That tobacco control and specifically tobacco tax, we often get this argument, counter argument is that it's regressive. I want to throw that open to the panelists because it is a question we get a lot.
Yeah, I'll jump in on that one. So this is an area that we spent a lot of our time working on and working with some think tanks throughout the region, throughout the Latin American region, to try to develop evidence to address. And what we see is it's actually the opposite that's the case. Rather than tobacco control and tobacco taxation specifically being regressive policies, they're very progressive. And I think that comes from a couple of different factors. One is that when you raise taxes, lower income populations, lower SES populations are the ones that respond the most. They're the ones that are most likely to quit smoking, to cut back on smoking. And the result of that is when you start to look at the long-term implications, they're going to be healthier. They're going to spend less on healthcare. They're going to be more productive. Their incomes are going to go up. So this is work that Alan Fuchs and his colleagues at the World Bank began in Chile in the region, and that we have now applied, Alan's applied around the world. And we see this over and over and over again in countries that tobacco taxes in particular, tobacco control generally, have very progressive effects when you really start to factor in these longer term impacts. And I think this gets back to some of the arguments around development as well, and the importance of these taxes, these policies as a way to promote development, because a healthier population is going to be a more productive population, is really going to enhance economic growth. So it's a false argument, a lot of good evidence. If you go to the Tobacconomics website, I'm sure PAHO has the links. If you go to the World Bank, you'll find study after study after study that makes this point.
Go ahead, Abdul.
Yeah, I would just like to add one or two quick points to what Frank just said. I completely agree with that. That's very direct to the point. And I think what we need to emphasize more when we talk about tobacco taxes and cigarette excise taxes is that the main reason for putting these taxes in place is not to generate revenue. It's actually to help to improve health and well-being of people who are at the risk of tobacco consumption or tobacco use. So that has to be the first point, because it tends to be seen as a way of generating revenue. Well, that's true, but that's not the reason why it's being put in place. So if the argument is made that, well, you are punishing, the low-income people in that tobacco taxes are regressive. Now, but that's not the issue. The issue is not that they are being targeted. for being poor, or that they will be at a disadvantage. And just as Frank has said, mentioned, they actually benefit more because it's more effective for them, and then it improves their health. Another argument which I've heard, even among economists, is that well, but these sin taxes they are quite inelastic, right? Which again we know that, and this was also discussed in the Tobacconomics scorecard. But the issue is that, well, if it's high enough, then it's going to be effective. And if you're looking at inelasticity, well, it's not because you are trying to use the elasticity again, it's not merely because you want to use this to generate revenue. It will result into that, but the effect is that you want to raise prices to reduce consumption or reduce demand. So if it's inelastic, then the higher the increase, the better, because what you are trying to achieve is to look at what will be the effective marginal decrease in consumption or in demand. So the higher the taxes are, the higher the prices are, then the better and hopefully more effective will be that tax policy. So I just wanted to add that contribution to you. Thanks. Yeah.
Thanks so much, Abdul. Really, really excellent points. I hope that answers the question from the participant. Unfortunately, we're actually now 6 minutes over time, and I'm mindful of everyone's busy schedules. I'd like to thank everyone. First, I'd like to thank our panelists for your contributions today. It's been a really helpful and meaningful discussion of these important issues. I'd also like to thank the attendees for joining us. It really is great to see a good turnout, and actually a number of familiar names of folks who I know are really committed to this cause. And then I'd like to also, I'm going to make an offer, I suppose, is if you have more questions or want to dig more deeply into this, both, I can tell you that PAHO and we at Tobacconomics are always very interested in hearing from you and helping you work through these issues. We work all around the world, both organizations, and we are really committed to this endeavor. So I thank everyone, and I wish you all a great day.
All right, thanks, Earl. Bye.
Thank you. Take care.